Hi everyone, Leanne here from No Cure for Happy, a breast cancer channel on YouTube. I wanted to tell you guys a little bit more about the next steps for me and what's currently happening. So if you saw my last video, you saw that I have had disease progression in spite of being on treatment. So what does that mean? Does that mean that the medicine isn't working anymore? No, the medicine is still working for some of the cancer. The new lesions in my bones are oligo progression, which means that even though we found them in both sides, um, we're gonna call it oligo progression, but if it suddenly pops up in a totally different bone, like a long bone in my leg, or if I get a new lesion on my spine or something, it's likely gonna be listed as something different than oligo progression, which means few, basically. We're all getting an education here, okay? So I wanted to let you know what the next steps are, because it's fair to say that this whole thing is a bit confusing. I was sort of under the impression, as I'm sure many of us have been before, that the medicine that they put you on, it's going to work, and then sometimes there's a speech that goes along with that that says, hey, it'll work until it doesn't anymore, and then when it doesn't anymore, we'll have another medicine to just sort of like put you on right away. And you don't think at that time, when that information is given to you early in the process, you don't understand what it really means at that time. In other words, you don't know how much time you'll be on a treatment that's potentially not working for you anymore, and therefore allowing some disease to progress. You don't know how long, because you just don't know which drug and when it'll be available. Is it available now? Is it in clinical trial phase? It's Is the government hanging on to some bureaucratic red tape and not releasing it yet based on our more stringent FDA guidelines? I don't know. It's all of those things, basically. So what I'm doing is I'm doing genetic sequencing, and I want to hear from you. If you've done genetic sequencing, what did that look like for you? Do you know what your gene mutations are? And if you do, has that helped you to know? Has it helped you inform treatment decisions? Also, who out there doesn't really want to be involved on that level? I'm curious to hear from you too, if you're one of those types of patients who is just happy to roll with the punches and go along with whatever the oncologist says. Having said that, I'd also like to hear from anybody who has had to strongly self-advocate, and I'm curious to know what that's looked like for you. Give me all your stories, give me your anecdotes of that one time when you had to say XYZ to your oncologist, or that one time when you had to escalate things, or maybe it was a time where you had to actually switch oncologists. I'm not there right now. I'm just dealing with, I think, some normal communication and misunderstanding type things. Like, for example, I have my language, my oncologist has his own language, and sometimes we might feel like we're on the same page, but then find out, oh, what I thought that meant was totally different than what you thought that meant. So I want to hear from everybody out there if you've come across these challenges, and sort of what that looked like for you. So next steps for me, I wanted to talk about them a little bit in more detail here. Next steps for me are to meet with a radiation oncologist. So again, that takes time. So here I am in sort of like no man's land, where I'm not receiving my treatment plan is not optimal. Let's say that, because we know that there's disease progression in spite of the treatment. So trying to figure out why, when you're on 3 different drugs, how do you know which of those 3, maybe it's a combination of 2 that have stopped working, maybe all of them have stopped working, maybe it's only one. How do we know? And there's so much time involved in doing the trial and error method that's really not the fallback plan. So I'll be going through a bone biopsy. Thankfully, there's a study out there that does some genetic mutation testing on tissue samples. And so it gives me more information than I actually need right now, or that is even useful right now, meaning that it is testing for some genetic mutations where there aren't yet therapies available to target them. But it is also testing for known genetic mutations where there are current targeted therapies. So we could glean some really good information from that, and then also put that in the bank for a certain time to help us inform, immediate future type treatment decisions. If it went any further, like let's say I started on a new drug and then a year from now it stopped working, I would probably have to do maybe another biopsy. And at that time, like a liquid biopsy, a blood draw, might suffice, might be sufficient enough to test for known specific mutations. This is my first kick at the can. I'm not sure why, but when I was first diagnosed, all they did was hormone receptor testing and HER2 receptor testing. They didn't do genetic sequencing. I did ask. Go back and look at some of my videos from like the first chapter, because I did talk about oncotype testing. And so I'm curious to hear from anyone who did that. What is that? Did you get any genetic sequencing with that? And if so, did it help you inform your decisions on treatment beyond chemo? Because I know it's handy in helping people decide, do I do chemo? Do I not do chemo? But is it helpful to do oncotype testing for treatment decisions outside of the scope of chemo? I'm curious to know. Let me know in the comments. For all also included in next steps. Sorry, I'm tired. Meeting with the radiation oncologist. So because that takes time, we're doing the genetic sequencing through bone biopsy, but the radiation oncologist is going to prescribe some radiation. I'm thinking it can be anywhere from like one massive targeted treatment to the areas that we know to have progressed. Or are we going to do like 2 sessions, 3 sessions, anywhere up to 5 sessions? I can't imagine they're going to do any more than that from what I've been reading on the PubMed. But let me know if you've had experience with palliative radiation for disease progression while on treatment or pain relief. Let me know what your experience with that was like. I'd be curious to hear from everyone. Beyond that, I'm hoping we've taken enough time to sort of take care of those housekeeping measures, that we get to that point where either the new drug is available for me to try and we know that I have one of the genetic mutations that drug targets at play, or that we know something, that we know something. So I'm sure many of you have been in the same position where you've been in a state of not quite optimal treatment, knowing that there's disease progression, but still having to take the meds, even though they might not be working fully. So let me know. I think I'll leave it at that for now. I'll probably make another video to talk about how the bone biopsy goes. That's coming up. So, good news, I found out that they're giving me like the full fentanyl special. Hopefully that's not triggering for anyone. But fentanyl is very safely used in a hospital setting for IV sedation. It's not the full general anesthesia, which is great, but it is sort of like, I think it's a combo of Versed and fentanyl, and it's meant to sort of provide you with comfort, sedation, you can sleep if you choose, and also a mild amnesiac effect so that you sort of like forget very quickly thereafter. It's kind of wiped from your memory. So the idea there is that you don't remember the pain and aren't left with any lingering trauma. Side note, I had 2 bone marrow extractions slash biopsies back in, I want to say it was 1994. And that was for staging for Hodgkin's lymphoma. And I had 2 only because the first day that they came to do it, they couldn't get the sample. Those young, teenage, healthy bones of mine. And so when they came back the second day, better prepared, more grease in the elbow, ready to take on the project, they were successful. But I will be honest here and say that I remember screaming. I remember it being just very uncomfortable. And I remember childbirth as well. And gosh, I think I'd rather have a baby, if I'm being honest. At least you have something to bounce on your lap. Yeah, giving them a sample of my bone is not as invasive as sucking the juice out of the core, but they will take a core sample. Yeah, it should be interesting. So I'll update you guys after that procedure, and that is coming up, like I said. Oh, one more thing I wanted to share. Behind me here, you notice my nasal cannula, and that's just because I've been noticing that I haven't been as oxygenated on a regular, and I've talked about it a little bit, but luckily, I'm so lucky that I have a really robust drug plan, extended drug coverage, extended health benefits, let's say that. Because when I called the respiratory solutions place, they were like, well, you know, you're not desatting sort of like regularly enough and for long enough for you to qualify for provincial coverage for your last 6 months that's remaining on your cycle. So what you could do is you could apply for it to be covered, and we can just purchase you new units, and you could apply for it to be covered under your extended health coverage. So after some phone calls and some paperwork, I was actually approved for purchasing my own home unit. So I'm now the proud owner of a brand new oxygen concentrator that's plugged in my home. And so I've been wearing it at night, and I have definitely noticed higher energy levels, and I'm able to sustain activities for longer in the day because it had been sort of like dropping off again, and I'd been finding myself sort of in bed like around the 5 o'clock mark. So I'm like, how's my family gonna eat, right? So so I've been sleeping with it, and that's been helping like a lot. And then lucky for me, I have a portable unit as well that I was able to purchase through the same extended benefit plan. So very lucky. And I must say, I don't see myself using my portable unit when I'm out and about. I'm not out of the house for long enough for it to be useful. But we'll see. Like if I take a sharp turn at some point, at least I have a safety net knowing that I have the concentrators at home, that I own them, and that they're warranted, and I don't have to go through a blood gas arterial test again, which if you've been through one, you know what that's like. If you know, you know, right? So yeah, that's all fine and dandy, and I'm just processing all of this. Like, you guys are all aware that it's not easy to deal with disease progression while on treatment. It's like anything in life. It's difficult to accept. You go through all the phases: sadness, anger, acceptance, denial. You know, there's a new order each time, and everyone starts in their own place. I've been describing it lately as like a big map that we're all on, but nobody knows the territory, and there's no "you are here" sticker, and it wouldn't matter anyways because everyone starts in their own unique point on the map anyways. So it's like we're all on there, but we don't know the territory yet, and we have to just all figure it out for ourselves. And so some might be going through like the forest of delusion and entering like the canyon of doubt. Some might be in like the desert of denial. Some may have already traversed those areas and are now like coming out of like the deep trough of disillusionment and into joyful living again. And like, believe me, you go in and out. Like, maybe you're in let's call it like the gorge of gorgiosity. I don't know. Maybe you've already been there. Maybe you go there frequently, is what I'm trying to say. It's all the same map. It's the same territory, but we haven't mapped it out yet. And everyone gets to do it on their own in their own time. So I love those "you are here" stickers. They're so darn helpful, aren't they? That's it from me. It's been my longest video probably to date, so if you've stuck around, congratulations. Thank you. If you have any questions about what's going on, just drop them in the comments, and I'll try my best to reach out. Thanks for watching, and I'll see you again soon in the next video.